Hi, this is Josh Rubin from East West Healing and Performance. Today is the second edition of Low Back Pain, a Holistic Approach. Today we're going to be talking about stenosis. That's a pretty fancy word. It's very common in our society today. It used to be more common in elderly. As people age, they got stenosis, but now you're seeing it. I have clients in their 30s that are getting it. What stenosis is, there's many types, but the most common ones are, if you look at the spine, this is the pelvis and the spine, down the center of the spine is a canal, okay, the spinal cord goes down. That canal is called a foramen. When that foramen, okay, if you look at a circle, when that foramen starts to close up, it can impinge or close down on the spinal cord. That's called foraminal stenosis. You also have nerve roots that come out from the spinal cord at each level. Some come above, some come below the actual vertebrae. These are called nerve roots. These nerve roots supply your upper extremities and your lower extremities, and muscles, things like that. You can get nerve root stenosis as well, okay? Not as common, but you will see it. Now the question is, how do we get stenosis? From the medical perspective and my perspective, some of the ways you get it are poor posture, years of being very kyphotic. Kyphotic, if you're looking at your body from the side, this is the front, this is the back, being too much this way, or actually in your video, it's the opposite. So it'd be too hunched over time. The body adapts to that position. Poor nutrition and poor lifestyle over time. Eating too much of one thing and not enough of the other. Sugar. Another easy way to get stenosis is a disease called Paget's disease. That's basically from ingesting too much fluoride, and fluoride is actually in everything that you eat and drink today. So it can cause a buildup of bone and it can impinge on the canal. Also, people that overtake supplements such as calcium, the true calcium that people are taking typically isn't true calcium. It's like calcium bicarbonate, calcium phosphate, stuff like that. That can cause increase of bone growth, causing stenosis. So as the canal gets smaller and smaller and smaller, it impinges on the nerve roots or the spinal cord. So what happens is you start seeing people adapting this posture, because as you bend forward or flex, it opens the spinal canal. As you extend backwards or neutral, it closes the spinal canal. So that's why you see certain amount of elderly people hunched over, because it opens the spinal canal and relieves the actual pain and symptoms. Okay. The question is, why do we get stenosis? Yes, we can treat stenosis. It's really easy to treat with a 3 to 6 month corrective exercise program. The goal is to assess your client, see what's going on, of course. Just to simplify it, basically what you want to do is work with the client on the flexion side of neutral with all the exercises that you're doing. So your actual goal is to create a poor posture, is to strengthen all the muscles that are going to actually pull the person this way to open the canal. But actually measure the spinal curve, so normal's 30 to 35 degrees. You don't want to actually lock them in too much of a kyphotic posture, because now you're going to cause a disc pathology. Your goal is to get them as close to neutral as you can, but on the flexion side. So you might lock the curve at like 28 to like 30 degrees depending on the person, and create stability, strength, and power in this range, because now I'm in slight flexion, which opens the spinal canal. So it sounds crazy, but you actually want to strengthen the hamstrings, the glutes, the rectus abdominis, things like that that can actually posteriorly rotate the pelvis, flatten the back a little, and pull them in a flexed position to open the spinal canal. So if you're working with someone that has spinal stenosis, or you're working with a therapist that has spinal stenosis, and they're having you go into extension and it's causing more pain, it's because you're impinging on the nerve roots. Common pains and common signs and symptoms are, radicular pain down both legs, lack of sensation, numbness, tingling. Those are the most common signs. Or it's easy if you ask your client or you ask yourself, when I go into extension, meaning when I go to neutral or bend backwards, does it cause more pain? And if I'm in flexion or hunched over, does the pain go away? Those are typical signs of stenosis. Now, from our perspective, a holistic approach, we've got to figure out where it's coming from. Because if you just treat the stenosis, that's the actual branch of it all. The root is where it's coming from. And I can tell you from working with hundreds of stenosis clients, can I say exactly where it's coming from? No. But I can tell you from cleaning up the nutrition and lifestyle, looking at the amount of toxicities in their environment, in their food, the amount of physical stress or toxicity that's going on in their body, and eradicating all that, that in itself, along with the exercise, is the key to success. Okay, just doing the exercise will alleviate the pain for the time being, but in the end, change their nutrition, their lifestyle, balance the amount of stressors from physical, chemical, mental, emotional, spiritual, nutritional, on and on. They're never going to get better. Okay, so the bottom line with stenosis. Okay, if you're diagnosed with it, don't think your life is over. Work with a Czech practitioner or someone that's skilled enough to actually know what they're doing. The goal is to actually create somewhat of a poor posture inflection that opens the spinal canal, okay, to alleviate your pain. This is typically a 3 to 6 month process. Yes, you'll get results along the way, and your pain symptoms will be alleviated, but the absence of a symptom doesn't mean balance, okay? So from our perspective, working with people on their ergonomics at home in the office, working on their nutrition, working on their lifestyle, maybe balancing their hormones, their neurotransmitters, seeing what's going on in the gut, all these things are the root to people's problems. Typically where we see a problem, it's kind of our body's way of going, hey, something going on. But you can't always look where the issue is, because if you do, then you're only looking at the body with binoculars and you're only treating the symptom, which is typically Western medicine. And a holistic approach is using all approaches for one person, meaning you will use some Western approach, but you also want to look at the Eastern side of it. Where is it coming from? What is the root? And it's going to depend on person to person, so make sure you assess your person physically, nutrition, to figure out and develop an individualized, prioritized, comprehensive exercise and nutrition and lifestyle coaching plan. So if you want to learn more, please visit our website at www.eastwesthealing.com. You can visit our blog at blog.eastwesthealing.com, or stay tuned for our YouTube clip for the next edition of Holistic Approach of Low Back Pain, which will be on disc derangements. Thanks, and have a great day.